So we have a new update tonight on the state's new public health lab, a story we've been following for months now.
The results of a surprise federal complaint investigation have come in and highlight issues with the lab's newborn screening process. And tonight, another mother is speaking out.
Ashley Moss with the latest.
Now, the state tests approximately 50,000 newborns every year with this screening, which is why we've been following the story so closely. A scientist told me earlier that the lab is like a reference point for all hospitals and county health departments in the state, so not having one that's functioning properly at any level is damaging.
Families that are told that their newborn may have a crippling, lifelong disease, you can't tell me that that doesn't negatively impact Oklahomans.
Among its findings, the recent investigation into Oklahoma's public health lab suggested that the lab failed to follow its standard operating procedure for verifying its newborn screening intervals from April 2021. The health department confirmed that report, but says the citation was for missing documentation and, quote, records were evaluated to ensure there were no patients who were negatively affected by the findings. A CMS spokesperson adding that standard level deficiency does not represent a negative outcome or potential harm to patients. But you can't tell that to Lori, who's a first-time mom. We first spoke with her mom, Janice, back in June about how an out-of-range result for one rare condition with only 20 to 30 cases in the world devastated their family for the first 6 months after her granddaughter was born.
The first few weeks of a newborn is challenging enough. I should have spoken up sooner, but at that point I was just trying to live through it.
It shows lack of compassion, lack of concern, certainly lack of a desire for accurate testing.
Looking over those results, the former president of the Oklahoma State Medical Association said the problems with botched newborn testing have only increased since it moved from Oklahoma City to Stillwater.
The lab has come back with a false positive rate that's 150 times what would be expected. It's really crippled the lab's ability to perform its public health mission.
Lori and Janice say with all of those red flags, they still wonder how many more Oklahoma families are dealing with this problem.
We rely on them to get it right the first time.
We're talking about a public health lab that cannot be trusted for accurate results. And no one seems to be real concerned about it.
Now, there's an action plan for the public health lab to see if any corrective action is needed for any previous testing. But another big question we're working to get answered, if the lab did not verify and validate newborn screening testing that they started back in 2021, are there other tests that they also failed to verify?